Welcome to Good Morning USA. Today we will be discussing whether or not healthcare should be nationalized. The United States is one of the world's only developed nations that does not guarantee universal healthcare coverage for its citizens. 27 million previous uninsured people will gain coverage under Obamacare, according to the 2013 White House estimate. The United States spent $8,508 per person on healthcare in 2011, and over 2.5 times the average spent by member countries of the OECD, which is $3,322 per person. The U.S. 5-year survival rate for all cancers is 64.6%, over 10% higher than the 5-year cancer survival rate in Europe, which is 51.6%. In 2009, a study found that the United States had better cancer screening rates than the 10 European countries, including France, Germany, Sweden, and Switzerland. In 2014, the Commonwealth Fund ranked the United States last in overall healthcare behind the United Kingdom, Switzerland, Sweden, Australia, Germany, Netherlands, New Zealand, Norway, France, and Canada, in that order. A few fun facts about the countries I just mentioned include Switzerland, which is on the top end of the rankings, have Democrats that enjoy that everyone has universal coverage. But on the other hand, they have Republicans that like how it isn't covered by the government, but privately as well. Canada, which is on the lower end, have citizens that have all their health care that is funded from income taxes. The citizens there never see a bill, and it goes right to the government. The costs are rising in Canada, but they are still lower than the U.S. Now we take it to Megan and Fletcher to debate this nationwide healthcare issue.
Today I'll be arguing for nationalized healthcare.
And I'll be arguing against it.
My first point is that instituting a right to healthcare could lower the cost of healthcare in the United States. Total public and private healthcare spending could be lowered by $1.8 trillion over the next decade due to lowered administrative and prescription drug costs. According to the American Medical Association, on average, private health insurance plans spend 11.7% of premiums on administrative costs versus 6.3% spent by public health programs. In 2010, the United Kingdom, a country with a right to health care, managed to provide health care to all citizens while spending just 41.5% of what the United States did per capita.
On the other hand, a right to health care could increase the U.S. debt and deficit. Studies have concluded that the expansion of insurance coverage under Obamacare will increase the federal deficit by $340 to $700 billion in the first 10 years and up to $1.5 trillion over the second decade. If everyone in the U.S. were covered under a completely nationalized health care plan rather than just Obamacare, the federal deficit would be even larger.
Even if it's expensive, a right to health care could save lives and ultimately improve the public health. According to a 2009 study from Harvard researchers, the lack of health insurance is associated with as many as 44,789 deaths per year, which translates into a 40% increased risk of death among the uninsured. This is due to the people in the U.S. being 33% less likely to have a regular doctor, 25% more likely to have unmet health needs, and over 50% more likely to not obtain needed medicines compared to their Canadian counterparts who have a universal right to health care.
However, this increase in people receiving health care could lead to an increase in wait time for medical services and a rationing of medical services. In countries with universal health care, there are longer wait times than in countries without universal health care. For example, in 2013, the average wait time for patients to see a specialist was 8.6 weeks, compared to 18.5 days in the United States. In the United States, fewer than 10% of patients have to wait more than 2 months to see a specialist versus 41% in Canada and 34% in Norway. Also, countries with universal health care universally have rationing systems because there's so many people who need the health services and it's more cost effective to ration health services. And with a universal health care system, that would be inevitable in the United States.
Even with a longer wait time, a right to healthcare could at least make medical services affordable for everyone. Paying for healthcare is the top financial problem for U.S. households. Between 2003 and 2013, the cost of family health insurance premiums has increased 80% in the U.S. According to one estimate for a proposed bill to implement a single-payer healthcare system in the U.S., 95% of U.S. households would save money and every individual in the U.S. would receive guaranteed access to publicly financed medical services.
However, for people who already have health care, paying for universal health care could raise taxes. In all countries with universal health care, it's paid for by raising taxes. For example, in Europe, the average payroll tax is 37%, which is much higher than the average payroll tax of 15.3% in the United States.
Now it's up to you. Do you want to nationalize healthcare?